Hello, everybody. My name is Dr. Francois Tessier. I am the CEO of the Center for Complementary Therapies and Pain Management in Sri Lanka. And welcome again to this YouTube channel entitled the Complementary Therapies Talks. Well, today I have no guest. Today I just want to introduce you the YouTube channel because many people are requesting some information about what we are doing, and today I decided to create that video to explain what is this channel about and what are complementary therapies. The main reason, first of all, that I created this YouTube channel is because people do not understand what are complementary therapies. They are confused. First of all, they confuse it with all sorts of other things. And so I just wanted to clarify what we are doing, because I'm receiving a lot of questions. People are asking, is it safe? People are asking, do you need to believe in something? Do I have to stop to see my doctor? Do I have to stop my medication? Does it contradict what the doctor is telling? Is it a fraud? Is it a scam? They don't understand. People in general don't understand. So frankly, I don't blame them, because the term complementary therapy was created recently, less than 15 years, I would say, in the international healing field, because previously we were talking about alternative medicine. But we are not using anymore this terminology, since we discovered that alternative medicine doesn't work alone, because the term alternative medicine implies that you are only using something in alternative to what our doctor doing. And in complementary therapies, we are working with medical doctor, Western medical doctors. You know, the culture of healing, the culture is evolving, and today we are changing the way that we are envisioning the healing. Right, so what is complementary therapy, right? The first thing that I should answer is this question. Number one, it does not replace classic medical treatment. Right? Because classic medical treatment, most of the time, has a very efficient way to diagnose what people have. If you have a certain problem that is diagnosed with Western medical science, you can rely on that, because Western medical science is a science and is studying the anatomy, is studying the disease and the disorder, and have clearly identified the source of disease and disorder. We need to have this knowledge, right? We also need to have their treatments, but sometimes we may need to have something else than their treatments to complement what the doctors are doing. I used to compare that like a relay race, right? The relay race is one racer run for a certain amount of meters, and after the certain amount of meters, he passed the stick to the next racer. So we are like that. The doctor starts the race with the stick, runs for a certain amount of meters, and pass on the stick to us. And then we are doing a certain amount of meter ourselves, and we repass it to other therapists, other specialists, because we can't heal one person with which only one approach. Most of the time, we have to complement each other. So that's the first concept in complementary medicine. In complementary therapy, we are a relay race, okay? Number two, holistic. The word holistic comes very often in the vocabulary. What does it mean? Holistic means the whole person. Psychological, physical, mental, emotional, and even spiritual aspect. All of the aspects are acting together in the health of a patient. not only the unicist approach. Unicist approach is focusing on only one single approach. For example, you can have a problem in your stomach, right? The unicist approach will only focus on the organ and will heal only this organ. But there may be causes that are underneath this organ that are not located in the organ, and the complementary therapies are qualified to identify and work with these underlying causes of the problem. So that's why the classic doctor will work on the organ, and the complementary therapist will work on the other aspect, and also maybe also on the organ as well. Okay. Natural. The word natural is very important. Natural means that we are working with the natural process of healing, because you know what? Our body, our DNA has a very important program that we call healing. The immune system is there, and also our body is made to restore itself when it has a disease, when it has a disorder. It doesn't mean that the doctors don't intervene. No, it means that it is there. It is always, it is in our DNA. It is in our program. So if you are working with the doctors that is giving you tablet, that is giving you appropriate medicine, plus the complementary therapist that is boosting, enhancing your natural way to heal, you are going to get a best result, a faster healing process for the benefits of everybody, right? The doctor wants you to heal, and the therapist in complementary therapies also want you to heal. Non-invasive, right? Most of the time, Western medical doctors found very efficient treatment. However, they are invasive, and also adverse effect is there. You have many adverse effects accompanying the benefit of the treatment. And it is very too bad, but that's the way science could deal with some disease and disorder, right? Most of the complementary therapies do not have adverse effect. Well, all of them, I must say that the adverse effect is not existing. We do not have adverse effect. We do not invade yourself with heavy technology, heavy surgery and all. So it is a non-invasive and adverse effect-free method of healing. Okay. Some of the disciplines of complementary therapies are research-based. Research are made to be discussed, criticized, but there is research, right? Some of the disciplines have a very strong, extensive research-based. Some are only empiric science. What does it mean? It means that empirically, over the time, there is observation of result. So by the accumulation of applying this and that and this protocol, we can observe the healing process going on. Is it the placebo effect? Well, we can do another talk about the placebo effect. What is the placebo effect? We can discuss about that. But the fact is that the empiric observation of applying these complementary therapies method have empirically, statistically, an effect on the success of healing or accelerating the healing of the patient. That's a very important thing. Sacred art or traditions. I live in Sri Lanka. I'm Canadian. I live in Sri Lanka, and in Sri Lanka there is a huge tradition of Ayurvedic medicine. It's even embodied into the health ministry. It is the indigenous traditional medicine. That's the same thing for India. That's the same thing for many other countries. There are a lot of traditions that are including natural approach of healing. These natural approach of healing are working also together with the classic medical doctors, but they are included into the natural healing process, natural healing culture of the country, right? Sacred art Well, there is method of healing that are considered as sacred art. These are more than traditional. These are very old practices that are reborn from a long forgotten past, thanks to some instructors, some masters that have unearthed certain methods of healing. So we call them sacred art. So as you can see, there is a lot of different origins. Okay? Who are the guests of this Complementary Therapies Talks YouTube channel? Well, actually, the guest comes from all the parts of the world. They come from United States, they come from Europe, they come from India, from Pakistan, from Singapore, from Japan, from Korea. They come from all sorts of countries in the world, and we are going to add more speakers, more therapists that are going to be adding to the list of guests of this channel, right? They practice all sorts of techniques. The guests are various therapists. They are practicing acupuncture, but they can also practicing animal health therapies. We are going to have some therapists that are doing fantastic job with animals. To help people to recover from ADHD, for example. You're going to see that on the channel. They are going to inspire us with their journey, because most of the therapists discovered their art, their science, along the way of their personal, professional evolution. So this is a very inspiring content that the guests of this channel are going to share with you. Most of the therapists have a different point of view of healing, and even one from another, they have different point of view. So we welcome them, because we want you to make your own decision, your own idea, your own thought about this as opposed to that. And there may be some approach that you connect with, and there may be some approach that you connect less. So that's okay, that's normal, and we welcome this diversity of point of view. However, they are going to explain, develop, and express this point of view of what is healing. And this is very interesting and rich. So we are going to open the debate over here about all sorts of point of view. Some of our guests have PhD, some are not, some have published some research, some have not, some have published books, some are even celebrities, some are even bestseller authors. So you have a very great variety of therapists that are going to be guests from this channel. So all I can say is this channel is informative. We want to keep you informed of what is complementary therapies, and mainly we want you to be healthy, to stay healthy, and to subscribe to our channel by clicking the button below this link, below this video, because you are going to have a lot of new content. All right? So thank you very much. And like people in Sri Lanka used to say, I go on. Thank you. Goodbye for now.